This morning, we are having a very critical conversation on NTV today, and it's about the International Conference on AIDS and Sexually Transmitted Infections in Africa. Casa is how it is abbreviated, and it's a major international AIDS conference which takes place in Africa every 2 years. Now, the conference is organized by the Society of AIDS in Africa, SAA, with support from the African host country. And the conference was actually last hosted in Kenya in 2003. This year, Casa is being held in Kigali, Rwanda, and Kenya has actually been shortlisted, among others, selected to host the next event in 2021. So this is a big deal for the country as we gear up to ensure that we get to host this very important event. And a team of evaluators are actually around in the country to determine Kenya's appropriateness for hosting this high-profile international event. And I'll introduce you to some of them who are already with me in studio. I'll start off with Professor John Idoko. He is a president of Society for AIDS in Africa, and he's from Nigeria. Thank you for joining us. We have Dr. Namwinga Chintu, who is a pediatrician first, and of course, part of the Society for AIDS in Africa. Thank you for making time. You come all the way from Zambia.
Yes.
All right, karibu sana. And of course, we have a representation from the host country, and of course, from the National AIDS Control Council, Joshua Gitonga, who is part of the monitoring and evaluation team at the council. Thank you for your time.
Thank you so much.
All right. Now, before we get into ICASA, because of course this is very important, it's our core conversation today, let's take stock of the status of HIV and AIDS in Kenya and broadly the continent. That's why ICASA is coming together in the first place, yeah? So to start with, we just had that report that was released by the Ministry of Health that said there seems to be a spike in the mother-to-child transmission in the country. Why do you think that's the case, Joshua?
Okay, thank you so much, Gladys. And first of all, just allow me possibly to give an overview of where we are as far as HIV and AIDS is concerned in the country. Number one, we are aware that approximately 1.5 million people are living with HIV and AIDS in Kenya. And when we look at the rate at which people are getting infected, we are looking at around 53,000 being infected every year. This is why we are saying that we need to do something. We can't have such high number getting infected. Another thing that we know is that also when we look at the AIDS mortality, or those who are dying because of HIV, we are having around 28,000 within the country.
Annually?
Annually. And therefore, because of that, that is why the government, with the leadership of National AIDS Control Council, is really out to ensure that we are able to address that burden. Now, coming to the issues of mother-to-child transmission, yes, we realize that the numbers are high, and the country is putting in systems to ensure that we address it. Possibly the question is why. One of it is that, yes, we have been able to identify mothers and started them on treatment. But there is a proportion that we have not been able to get. To be precise, around 25% of pregnant mothers who are living with HIV, we should be put on treatment. We've not been able to identify them. That is one area that we need to address. The other area that we have also realized is that there are those mothers who become infected during the pregnancy. And therefore, that's another area that we say, even though you are tested at the beginning, you need to take care because you can be infected during the time of your pregnancy. And that way, you will be able to transmit the HIV to the unborn child. The other area that we've seen is that also there are them that become pregnant, and at that point, they are on treatment. But along the way, they fall out, they drop out. So yes, we have done a lot of progress, but there are things that we need to look into in terms of those who are getting infected during pregnancy, those who fall out, they are on treatment, but during pregnancy, they stop. These are the main, this is the cause of the high MTCT rate, or mother-to-child transmission, that we are seeing. But through the Ministry of Health, really robust interventions are being put in place.
Okay, so there were some counties that were highlighted: Homa Bay, Nairobi, Siaya, Kisumu, Kakamega. Is there anything particular about these counties that made their numbers spike other than other 47 counties?
Looking at the data across the country, we have seen that spike across the counties in the country. And the main explanation is what I've just taken you through. So even though we have those areas, of course we look at also the load in terms of the number of mothers that are in those regions. They are also quite high. And also in addition to that, we know that the burden of HIV also is high in also the counties that you have mentioned. Yes.
Okay, so let's get a perspective probably from another part of the continent. And I'll start with you, an outlook of Zambia. Mother-to-child transmission, how does that look like, and what have you done to ensure that you actually curtail the numbers spiking?
Sure, thank you very much. I think similarly to what my colleague has explained, we're also sort of going through a similar issues with PMTCT. I mean, the idea is to eliminate mother-to-child transmission of HIV. So every new infection is an infection that we want prevented. So we still have to go the extra mile to, one, find those mothers who have not been identified, and also, two, to make sure that women adhere to their medication, and adhere not only during pregnancy, but during the breastfeeding period as well. And you can also imagine what it's like for these women who've been newly identified. Sometimes it may be an issue to adhere to treatment that you started in pregnancy. This is supposed to be lifelong treatment. So we find that sometimes these women, as my colleague has said, fall off. And this could then lead to acquisition of HIV by children during later periods, even though they may have escaped, you know, during the pregnancy and during childbirth. But the breastfeeding period is also a very important period for acquisition of HIV. So even though we've made significant strides, we still have to push the last mile, which is you know, hardest. I sort of equate it to running a marathon. The first few kilometers are, you know, you have the strength, but the last few, getting those last women and those last infections eliminated is the most difficult part. So we're all sort of facing the same issues in Zambia and in Africa in general.
Okay, Professor Idoko, Nigeria has a high population. We're talking about not reaching everybody, and Kenya has a lesser population. What is the status in Nigeria, and is there a gap especially when it comes to childbirth?
Thank you very much. This is one area where we haven't done so well. Up till about 4 or 5 years ago, I'm sure you know my colleagues here will tell you that Nigeria was responsible for 60% of the transmission. Again, prevalence is not so high, but just like you said, the population. Every year we reckon that between 7 and 8 million women get pregnant in Nigeria. So that's a huge number. But I can tell you that we have had a very, very significant drop, you know, in this transmission. And the ways that we did it are partly what has been said. First, you must identify the women. Because the crux of it is test all the women if possible. If you can test all the women, you can identify those, you know, who are positive. And we do know now that, you know, if we identify the positive ones, we can help them with the drugs along the way, you know, certainly they will not transmit. How do you identify them? That's the big problem. And a lot is done in the various, you know, health facilities. But I think in the community is very important. Identifying the women in the community, and particularly using women who have gone through that. You know, HIV positive women, either who have become pregnant and gone through this, or women who are positive, using them at community level to identify, you know, and test pregnant women makes a lot of difference. And then ensuring that you also train I don't know, but in most African countries, traditional birth attendants, skilled birth attendants,
yeah.
all these are trained, you know, to identify and request for testing for these women. You know, it drastically brings down, you know, this transmission. And I think that's what we did. And I can tell you that we've really gone down. At the point that I was saying 5 years ago, our prevalence was hovering between 4%, 3%, 3.5. For a huge population, that's a lot.
Yeah.
But today we are 1.4. And with all these strategies, even the pregnant women, you know, we still have some positive women transmitting, but it's down by well over 70%.
Okay. Now, still on new infections, Joshua, a 2018 report by your council showed that despite an overall decline in HIV prevalence in the country, there was still a leading concern in as far as the new infections amongst adolescents. And I think the report even by the Ministry of Health last week talked about the same.
Yes.
We are struggling in this area. Why?
Yes, it is true. That is the position that was given as far as that report is concerned. I want to say that you've put it right. Number one, that we had the number of new infections within the country decline across most of the age cohorts. But we realized that when it comes to the adolescents or the young people, that was not the case. And therefore, one of the things that we would wish to look at is how do they get infected? Mostly, there are two main ways. Number one, they were either born when they were HIV positive, meaning that they have grown up living with HIV. The second way is that you become vulnerable because of behavior and because possibly of the environment. And that is the second one that really is the highest cause of the infections among young people. Now, looking at it, we have had a number of areas that we need to address. Number one, looking at the young people and empowering them economically. That's there. Because basically, once they are not empowered, then we see them trying to get the economical empowerment through various ways, as we know. I think it's one area that we need to address. The second thing is we've also seen education. When you retain them in education more, then they are able really to delay things like sexual abuse. And once that is delayed, then exposure to HIV is also delayed. So I think that is a critical thing. The other thing that we've seen is that apart from the sexual debut, which of late we've seen really it has continued to go up, and that is what we want. We don't want them to start quite early because of also other reasons, biological, physiological, and all that. So we want to delay that, and education has been able to do that. The other area is that protection for them that are sexually active. Empowering them to have knowledge, to know that they can be able to protect themselves. Unfortunately, when we look, is that is the age that least protects themselves in situation of exposure. Because one, when you look at the people also who are responsible, at times they feel not empowered enough really to be able to say possibly no and yes, where it needs to be yes. So that's also another area that we have seen coming in. Of course, we know also when it comes to the other behaviors that make them more vulnerable, like in terms of key populations, we have seen the tendency of young people also to kind of, the young people are also in such behaviors that possibly find they predispose them. So for me, looking at it is really two things. Yes, there are those who are infected because from childhood they have been living with HIV, but for the rest, it's just because of that heightened vulnerability because of either environment, because of the behavior, issue of sexual partnerships, concurrent, that is really high. During that age. So these are some of the behavioral, socioeconomic factors that are coming in, and really they are making the young people to be more prone to HIV infection than the other age cohorts. Now, as a country, as you know already, we have been out in the media. We have done activations in schools. We have ensured that the curriculum has been revised to include issues around HIV. We have also had a number of conferences, and as we are talking right now, there is actually a global conference that is taking place in Kenya, just in Westlands, and they are sitting there to discuss the issues of the young person as far as HIV is concerned.
Okay. All right. So Joshua touches on vulnerability, and Dr. Namwanga, I think this is not a preserve of Kenya only. We're talking about the economics of things. And this has mostly led to what is now called cross-generational relationships, where girls are trying to make ends meet, especially the girls because they're the most affected. And also the lack of not being able to afford a pack of pads during their menstrual cycle. How is the status in Zambia as far as this is concerned?
Well, we actually did an interesting study, but this was on early marriages in Zambia. And what we did is that we looked at couples who were married before the age of 16, if I think I have this correct. Of course, we went through all the ethical procedures and so on. But what we found was interesting. This was in a rural community in Zambia. What we actually found was interesting. We did not find transgenerational relationships. What we found was teenagers marrying teenagers in rural Zambia. And this was partly because in their households, neither families could afford to continue, school and continue supporting them. So eventually, as they sort of became of age, they were encouraged to get married. So we found that in these villages, they were teens marrying teens, and not necessarily teens marrying older. So that was a very interesting finding. Of course, this is driven by poverty and education. But I would also like to go back to one point. In Zambia, we also did population studies looking at individuals who had HIV and whether they knew their status or not. And one thing that we did find was that the men actually did not know their status. So we're finding that men and younger populations, as in Kenya, are actually the populations that we need to be targeting. And we need innovative ways of demand generation that speak to the youth, that speak their language, so that they can come in and get tested, because what has brought us here will not necessarily take us to the future. So we have to be innovative, and we have to include adolescents in the messages that we develop and in our programs, because otherwise we will not reach them.
Okay.
So I thought I'll just bring up those 2 points.
Very important, actually, knowing your status. Professor Idoko, that was the theme for last year's World AIDS Day. And I mean, knowing your status is one thing, disclosing it is another thing. And this has also been said to probably fuel the new infections we're seeing amongst the young people, because to them, they're afraid that somebody else would stigmatize them, so they'd rather keep it to themselves. How is the status in Nigeria?
Well, young people are a problem, in Nigeria, just as they are in Kenya here. We have, over the last 10 years, seen a very gradual but significant decline in the general population, but in 2 subsectors of the population. Adolescents, like you mentioned, and then key populations. And I fully agree with my colleague. If you look at young people, the biggest problem we have with them is lack of knowledge. They're poorly informed. Then there's, peer pressure. And when they get infected, they don't want to disclose, which is what the point you're making. It's a very difficult thing. And I think that the way we're solving it is trying to find, clinics that are friendly to young people. Because you will not find young people going to clinics where, they find adults because of the issue of stigma. We also have a lot of young groups, particularly young people living with HIV/AIDS. And they do a lot of good job at the level of the communities. When young people see their peers who are positive, disclosing and telling them, well, look, we've been here for years. In fact, just recently we had a group of young people who had passed through, PMTCT. They didn't acquire HIV through sex or blood. They just did it because they were born into life. And they're living normally. So the strong message from those group of young people makes a lot of difference. So young people to young people is a critical way of transmitting the knowledge that is going to bring young people for testing.
Okay, now they say information is power. As you said, Joshua, campaigns have been done and you've gone even into the schools, and people know that you can live a long life living with HIV as long as you keep to your ARVs. But then again, there's a twist to this, because there seems to be these young people who seem to be more afraid of getting pregnant than having HIV because they know there are drugs for HIV, and it's not on my face that I have HIV.
Yes.
Is this playing a huge part in seeing this number spike?
Completely. Listening to what has been happening across the country, one concern that has been raised is the teenage pregnancies. Now, one thing that we know is that for you to get pregnant, it means there was no protection. So for me, taking that even they are more afraid of pregnancy than HIV, but on the other hand, they have not taken enough measures to protect themselves, then means that yes, you may not get pregnant, but you may get HIV. And not only HIV, because we know there are various other conditions and diseases that you can be able to acquire. So yes, I think the young people, we've seen a situation whereby they are more afraid of pregnancy, which can be seen, but HIV, unfortunately HIV will take really a period of time before it starts manifesting. And I think this is what is confusing young people. Because pregnancy, it is a few months and everybody will know that you're pregnant.
Yes. Yeah.
But now, when it comes to HIV, and with good nutrition, good health, seeking behavior, it delays really the signs and symptoms that can start showing you indications that something actually happened. You can imagine a young person thinking of 10 years ago, what happened? They can't put that together. No wonder then they're afraid of pregnancy that takes 2 months. And when we talk of HIV, they know it will be almost when they are past even the stage that they are in. So I think for me, yes, that is where the disconnect is. But the key thing is to say that really they should always protect themselves.
Okay, Dr. Namonga, something else that comes to mind, and I think Joshua can agree with me, there seems to be some sort of abuse of PrEP, pre-exposure prophylaxis. As we said, it takes a while, and this is something that is used by people who do not have HIV but are at substantial risk to contract it. Now, this has been part and parcel of people who say, I don't care what I do, whether or not I use protection, we have PrEP. Is this something that's a reality in Zambia?
Well, PrEP is an important program that we have, science has shown works very, very, very well. But what makes PrEP a little bit complex, as usual, is our behavior and how we use PrEP. If PrEP is used correctly, it obviously works. Now, it's one of the issues that we, for instance, having in Zambia is access to PrEP. Healthcare providers, for instance, have access to PrEP. But the daily, everyday young girl, or young man, we have to improve access to PrEP. And we have to keep giving out the messages on PrEP, how it works, what are the correct behaviors associated with PrEP, and how we can access it. I just want to just go back a little bit
Yeah.
to talk about a transgenerational relationships. Yes, I had mentioned that the study that we had done was in rural Zambia, but to mention that acquisition amongst adolescents is very complex. So we can't just do a one-size-fits-all. Transgenerational relationships do occur and could be one of the major reasons why we, for instance, find that incidences and prevalences amongst younger age group, women particularly, are higher than their male counterparts. So we must look at this holistically. And I just wanted it to be corrected to say that it's not only this is what is happening in Zambia, but it has to be looked at holistically, and it's very complex.
Okay.
But otherwise, PrEP is extremely important. If it's used correctly, it works.
Yeah.
Yes.
Professor Idoko, we've talked about the importance of thinking how we message messages to the young people, because they take in messaging differently from the adults. Now, I remember growing up, billboards, advertisements that would literally instill the fear of the Lord in you in as far as what HIV is concerned.
Yes.
And for some reason, that was in our faces for a long time, and I think it was also responsible for a drastic drop in new infections. My question is, how do we ensure we get the point home in as far as, yes, we have ARVs, yes, you can live a long, full life with HIV, but you've got to be very keen in as far as how you live your life to make sure you don't get HIV in the first place?
Well, I think that you have to address it from, a global point of view. And I think that I'll step out of the HIV message first and go to those things that we teach young people about self-esteem, about life ambitions, etc. They're critical. And I think that in most of our institutions, we start with that. Let me give a very vivid example. If you have a young girl who wants to be a doctor, you will agree with me that she will try in all her abilities to ensure that every message that you give her and is correct, she will try to stick to it, because she knows that if she wanders away, and if you build her self-esteem, because the confidence that young people have to negotiate sex is a critical point. So those two things are extremely important. Building, the confidence, giving them the right information, and ensuring that, as you bring up these young children, you are discussing things that are important in their future for them. That's outside HIV. Then I also think that the message of HIV must be given in a holistic manner. Sometimes we just talk about HIV. The whole gamut of sexual and reproductive health is a critical foundation to build on, because that's where they learn about the ABC before you even come to, the ABC of HIV. That's where you learn ensuring that, your first sex is not when you are 12, 13, or 14, and that even if you do it at 18, you are well informed. So those critical steps are extremely important, And then you now go to the message of HIV itself. Of course, those messages of those years, they helped. Just like, apart from the message you see when you see your neighbors dying, those were very strong, messages. You don't want to die, So, in a way, those are gone. But we still have a lot of issues with HIV. It's not a curable disease. You got to take drugs all the time. And if you don't take drugs, it will punish you. HIV is very unforgiving, particularly if you don't do the right thing. So all these messages are important. However, you must put it in such a way that it's not fear, because once you have fear, people even refuse to go in depth into...
to get tested.
So, and I think that given the message of ABC, etc., and all the things around HIV, by young people to young people is critical. By women to women, particularly women who are positive, is critical. The issue of men is very important. Although in most of our communities, in Nigeria, we'll find that we've just done one of the largest surveys, if not the largest, for HIV. And we found that the young girls, particularly between 16 and 24, 2.5 times, prevalence of men.
Mm-hmm.
But we also find the cross-generational issue, that it's actually the older men who are actually infecting these young girls. And we must find a message, a way of providing the message to the young girls and building their, capacity and empowering them. Because that's the critical thing.
Very important.
Just like my colleague, Dr. Chintu said, if you go to rural areas, there's poverty there. So it's balanced. But when you go into the urban areas, and most of our countries are really moving into urbanization, the imbalance comes up. You have a lot of very poor people, and they have a lot of, in that midst, very poor young girls. And then you also have a crop of middle class, young and old people who have the money. That's the attraction. Okay. And that's what transmits. So those are the things I think we need to start addressing in our various messages.
Important that Casa is coming up and is ongoing, because we can exchange ideas and see where we can help each other along. And speaking of Casa, this is why we're having this conversation to start with. I'll start with you, Dr. Chitu. What is the objective of Casa?
Well, Casa is actually an organization that is formed by Africans and initially started by African scientists and is more than 30 years old. So we have been holding Casa since the early 80s. I think Professor will also tell you a little bit more, but the first conference was actually held in Italy. But then it was thought that, the disease and the issues are actually in Africa.
In Africa, yes.
So we need to bring it down here to Africa. The headquarters of Society for AIDS in Africa, who are the custodians of ICASA, is actually in Ghana. And we have several member countries, in fact, in the whole of Africa. So the idea really is not only to support HIV progress in Africa, but also other emerging diseases. We also have malaria, we have TB, we have hepatitis, we have Ebola. And all these are missions that we are trying to push forward so that we can eventually have a forum that is talking about global health, of course with a focus on Africa. So the idea of ICASA is really to bring the best of the lessons learned in Africa, by Africans, for Africans, and to see how already we can see the similarities that we have across the 3 countries that are represented here. And you can imagine the wealth of knowledge that will be displayed when all these countries come together to share best practices and to learn from each other.
Okay, so Kenya is bidding to actually host this in 2021. Professor Idoko, there are other countries, I believe, who are also bidding for the same. Who are the other finalists?
There are 2 finalists. We started with 5, incidentally including my own country, but we lost at the preliminary stage.
Okay.
So let me step back a little and tell you about SAR, because I think SAR is very important, because ICASA is hosted by SAR and, the host country. And SAR, like my colleague Dr. Chintu has said, is the umbrella organization for, HIV/AIDS and related diseases in Africa. And we have membership spanning even Africa. We have a membership of about 5,000 people, in Africa, and some from, Europe and the US. But critically, we're interested, like you said, in ensuring that we contribute to diminishing the HIV epidemic. That's a big, big, big issue. And over the years, like you said, we have done a lot by exchanging, our experiences, our skills, our knowledge. That has really helped, because almost every African country has seen a significant drop in the prevalence of HIV. Gone are those days where coffee makers used to have a lot of, work. Exactly. We don't see that again. So, but, HIV, it's a very unique disease. Unique in the sense that once it diminishes your immune response, many other things override you. So tuberculosis is the biggest disease that kills even the HIV person. and it's still with us. But we've done a big blow to it as well. Then you have hepatitis. Hepatitis B, hepatitis C. They all ride on, persons. If you go into the population in Nairobi, those with HIV carry more hepatitis B and C than the general population.
Because of a compromised immune.
You have malaria, particularly, in pregnant women who are HIV positive. Then you have cancers. We used to see those days Kaposi's sarcoma, but we don't see that again. But we see a lot of lymphomas, cervical cancer, because HIV brings HPV, to infect you, and therefore. So you see all this.
Yeah.
So if we want to ensure that our patients live, we give them antiretroviral drugs, but all these other diseases can kill them. So SAR is no longer interested in only HIV. We want the holistic patient. So all these, we call them co-infections, comorbidities become important. Again, we also see another connection. That connection is this. We have seen as a result of antiretroviral therapy, people with HIV are living a normal life. Before, they had a very shortened life.
Yeah.
So their hypertension was not coming up. Their diabetes was not coming up. All this mental disease was not coming up. These are all non-communicable diseases that we find very prevalent in our. But intriguingly, because of an improving lifestyle in Africa, even in the general population, we are seeing more and more of these diseases. So this also becomes something we're interested in. We call this integration, and it's a major focus, even in the Casa that's coming up now, and even the one in 2021.
Okay.
So we now are looking at what we are doing as integration. We're now looking at what we are doing as global health, So from HIV being a pathfinder, we're able to now look at all these things and say, hey, this individual, we don't want to put him in segments or segmentalize them, if you allow me to use that.
Okay.
So we're treating the person with multi-disease.
Okay.
Okay.
So let's go to the finalists. You said there are two, Kenya and who else?
Kenya and Uganda.
Aha.
So they were the ones who got the votes. The ones that, were beaten to it were my country, Nigeria,
Yes.
Tunisia, and then our country, Zambia.
Zambia.
Isn't it very coincidental?
All right. So ICASA is bound to bring on board 10,000 delegates. So definitely immense benefits of hosting such a great conference. What are some of those, Joshua?
Thank you so much. First of all, allow me just to appreciate that the country were able really to be pre-qualified. As you hear, it is us and Uganda. The good thing being that it will come to East Africa.
Yes.
But we are happy that we have the team that is coming to assess, being with us here, led by the president of the SAA. So welcome. Thank you so much for coming. Now, when we look at really what it means to the country, great benefits. Number one, we'll be able to host 10,000 and more with the kind of mobilization that the country can be able to do. I'm seeing numbers even which will go beyond the 10,000. And these are the people who come into the country. We are thinking of the foreign exchange that we'll get. We are looking at the benefits to the hotel industry. We are looking at the other supportive services that will be given. And all these will be available. We talked about young people here. If that comes to Kenya, we'll see so many young people who will be involved as volunteers, being initiated into the world of research, and they can start learning. So it gives the country an opportunity. I'm looking at also, when we are thinking as a country of the universal health care, that's really the discourse that is there across the country. And it's moving on well. So it gives us really an opportunity also to be able to learn from the other countries and the research that is available. We see how can we be able to fine-tune our response to HIV and the related comorbidities. So it is really an opportunity for the country, both economically, scientifically, because we can be able to get all that research basket that any time that we need it, we can be able to pick. And also it will be a forum to have our own scientists and the scientists from outside the country sharing the table and discussing issues that affect Africa. I think that will be a great contribution for us if it comes here. Just to mention that in Kenya, we've realized that, yes, we've put so many people on treatment, and I want to reiterate what my colleagues have said, but the main cause of the mortality is shifting now from HIV to even non-communicable diseases. In Kenya, we've heard about cancers. So we will be able to look at all that area and see how can we be able to leverage on the research that has been done or discussions, but really, if we are selected finally to host the Casa.
Okay, so Dr. Chitu, you're part of the evaluation team, and what is the pre-selection process? What does it entail for a country to get all the ticks they need to actually host this?
Yes, well, there is a pre-selection criteria, and some of the things that we generally look at, for instance, is the willingness to host, the political will to host the conference. We also look at the partners who are available to support the government to hold this conference. We also look to see if there is what we call a strong local organizing committee, which should be multi-sectorial, because of course a conference so large can not only be held by one portfolio or one component. We also look at things like financing. We also look at the infrastructure to see, can the country bidding actually hold 10,000 people of all walks of life, because it's from heads of state right down to the community, because this conference cuts across all aspects of the economic scale, if you want to put it at that. So this criteria that are shared with all the countries, and all the countries are aware, and in a nutshell, that's what we look for.
Okay, Professor Idoko, I mean, I hear you talk about and very passionate about empowerment of the youth, and one of the empowerment bit of Casa coming to the country is to provide scholarship for at least 300 local participants. Why is this important?
Well, just as my colleague has said, we put a lot of premium on young people for many reasons. If you look at all our countries, 70% or thereabout of the population is young, below 30, if you allow me 35 years. We say that those are the leaders of tomorrow, but they're actually the leaders of today. So it's very important that we must put emphasis on young people. And we just discussed a while ago how difficult it is to provide the correct information to this group. And how difficult it is for them to access, treatment, and how difficult it is for them to even remain on treatment. So it's, if we really, and how we are all seeing in our countries, that even though the prevalence is going down amongst every other person in the population, theirs is actually going up. So you see why the young people become extremely important. So it's very key that we must bring as many young people as possible to the conference. The other reason is the point that he made. One of our big objectives is research. We must grow the research. It is from the research we get all the knowledge, we get all the skills, and a number of us are almost retiring. We need some people to
fresh
handle
blood.
Exactly. So we need to grow these young people, so that in research and in good research, so we can compete effectively, with our colleagues and our peers, on the other side of, the world. So young people are extremely, extremely important. And the demographic profile of our countries in the many years to come will still remain what it is. So that's why we insist that, knowing that young people won't have the kind of pause that the older generation will have, assist them to come to this conference.
Okay. Now we know the National AIDS Control Council is at the front line, is spearheading to get this bid and host a Casa in 2021. She talks about political goodwill being one of the criteria. How much of it do you have so far?
I would say that we've really done a lot, and we've been able to take the team around the country leadership, from within the Ministry of Health and all the relevant structures, including to the hand of the country, so State House. Because really looking at even our President, His Excellency, has been on the front line on issues to do with HIV and universal health care. So when we look at the country, we have the blessings of the leadership. They are part of it. We have a very strong, the local organizing committee, as the colleagues have mentioned, which cuts across private sector, civil society organizations, the government, and anybody who has, and actually the media. Just to mention that as even as we're continuing, this part of it. So yes, it is actually part of it. So even by what we are doing here, it is going to contribute towards Kenya beginning the required scores to be selected to host Casa in 2021. Therefore, I also want to appreciate the nation for giving us this opportunity. Thank you for partnering with us, and I believe that with all this, we will be able to get that which is required for us to host.
Fantastic. Now he touches on universal health care. I mean, this is important across board, whether in Kenya, in the continent, the world over. And when you talk about political goodwill, it needs income, it needs finances to boost UHC. That is why we need to be backed up in as far as political goodwill is concerned. Speak on the importance of leaders plowing into healthcare.
Well, that is invaluable. It's actually priceless that leaders put this at the top of the agenda. Because if leaders put this at the top of the agenda, then it becomes a national issue, and it becomes an issue that percolates all the way from the top leadership right down to the community. And if that happens, then you see that health indicators across the board continue to improve. So without leadership, then you will not get that woman on the ground in the village, or that child receiving his or her immunization. So it's absolutely cardinal and critical that leaders are involved in universal health coverage. I think just going back to Casa, which is just next door in your backyard in Rwanda, you'll be able to see how much political will there is in Africa around this. And we hope that you and NTV and everybody else will be able to cross over to see and to get firsthand how Casa is done before 2021.
Okay. Yes. And if I'm correct, Casa in Kigali is being held in December, right?
Exactly.
Okay, so if we win the bid, we hope we actually get it.
Great.
When will we host it in 2021? The same month?
Same time. Always around the first week of December.
Okay.
Yeah.
All right. Now, having been part of the evaluation team, what are some of the lessons we need to borrow from other countries that have hosted it and the ripple effects it brought to those host countries?
Well, I think I will start with the point that my two colleagues have made. The political commitment at the highest level is important because we reckon that the budget, and I want to talk about the budget because that's always the denominator, for Casa is between $4 to $6 million. And we expect that the host country should bear at least 30% of it.
How many?
30%.
Okay.
Yeah, so for example, things like the conference centers, the hotels, logistics of moving, the local secretariat and all that. And hosting a strong local secretariat, to drive the necessary, things that will sort of like mobilize people, but not only in this country, but around this country and even beyond. You know, so that's very, very critical. The other thing that we believe is critical is stability of the country. You know, when elections are coming close, we don't go. You know what elections are in Africa. Where there's a lot of, you know, civil strife, we don't go. Happily, we know that this is a very stable place. So, you know, so that's number two. I think the third and very important one is issue of hotels. We say 10,000, but we may find more than 10,000 here. You know, but I'm sure when you look around this place, there's so many hotels. So hotels are extremely important. Other logistics will be transportation, etc. So these are all very, very key things that, you know, we look at. And we had actually given all this to the countries that we're visiting, both Uganda and Kenya, and they've been addressing them. And then the LOC has to be very strong. Like she said, it's got to be multi-sectoral. Because like we've said, we're not seeing this thing from only HIV point. We're seeing it from all the other diseases. We want all the other sectors of the nation to be part of it. You know, we also want to ensure that, you know, the media is very important. The media is key, you know, because the media is the one that's going to inform people that, hey, you got this conference there, you got to be there, and all that. So all these things are extremely important, and we weigh them. And like she said from the beginning, we weigh them, and then we now pass it on to the board. The board takes the decision.
So how soon will we know?
Well, I think when we leave here, we'll have to put a report together.
Okay.
But usually, this report, I want to take the longest time. I won't talk about the shortest.
Okay.
We have to give the board will deliberate on it, and the result will come out before the next Casa, because there's going to be, is it a handover of the flag or the baton?
There's an announcement at the end.
There's an announcement at the end.
Yes.
And then the country that's hosting in 2021 has to attend and officially receive the flag for 2021 in Kigali.
Okay, so Joshua, definitely a very important forum that we expect to host as a country. The media has partnered to help you along the way. This is your opportunity to put out your clarion call in as far as all the support you need to make this a success.
Thank you so much. Just to say that on the part of the leadership, starting from National Institute Control Council, we have given it all just to ensure that we are able to meet the requirements of the society. Number two, we have also the leadership of the ministry that is behind this and driving it in a great way. Mine is to ask all the stakeholders, from the government, civil society organizations, the youth, the young people themselves, looking at the media, which we can't do much without, and anybody who has something to offer, including the venue, like the proposed venue will be the KICC, and therefore, and the hotels that will be able to accommodate those 10,000 plus kind of people. Just to call upon them and tell them, let's maintain that standard, let's put our commitment into ensuring that in case we go through, they'll be able to give high-class services at whatever level they are, so that we can get that visibility. And number two, the team that will have given that opportunity can stay and say, yes, Kenya is a good destination for tourism conferencing and such high-level discussions.
Excellent. Joshua Gitonga, Monitoring and Evaluation at the National AIDS Control Council. Professor Johnny Doko, President of Society for AIDS in Africa. You're from Nigeria. Thank you for your time. And of course, the lady in the panel, Dr. Namwinga Chintu from Zambia. Thank you for such a very important conversation. And again, Casa may be coming to Kenya. We shall find out in December, obviously in Kigali, Rwanda. And of course, as we said, it's an international conference on AIDS and sexually transmitted infections in Africa. It was last held here in 2003, and we only hope we can get the privilege to host it again in 2021. This has been NTV Today. My name is Gladys Shanja. Enjoy the rest of your viewing.